Talkopolis, the social media TV network for your city.
Hi guys, Kane Harrison here. Welcome back to Nashville Health and Wellness Programming. We are once again joined by Michael Ramsey, who is Director of PAI Medical Group at WeGrowHair.com. Welcome back.
Thanks, Kane.
Now, we've talked about a number of different procedures, which is brilliant, and I need to tell everyone at home that I wasn't aware of all these procedures, and probably at the moment I don't quite need them, but I may someday. But I think we've dispelled a few myths. And the great thing that I've learned is the fact that there are a number of different options that we can touch on. Just touch on all the options to start with, the names, and then we'll talk about what happens when someone comes in.
Okay. So we offer some non-invasive options for people who are beginning to thin in what we call early onset hair loss. We offer low-level laser therapy. We offer something called PRP. So that's great for those guys that are just thinning. For guys that have their hair really, really short, maybe have some bald patches, they like short hair, they're always going to keep their hair short, we offer a unique process called micropigmentation, where we fill those areas in and make everything look thick and full. On the surgical side, we offer something called ARTIS robotic system. It's a robotic transplant system that allows us to go in using a minimally invasive type of surgical technique, harvest some follicles from the back and sides, and then we plant those little seeds, those little hair follicles, in the areas where the patient's thinning. And then our trademark, our thing that we're most proud of, or I shouldn't say most proud of, but one of the things we're most known for is something called multi-unit hair grafting. And multi-unit hair grafting is a technique that we've trademarked a number of years ago that allow us to transplant more hair at a time for the patient who has maybe more advanced hair loss. Where the ARTIS system may be better suited for a guy with kind of early hair loss, or maybe somebody that's got a little bit more thinning than they like, where laser therapy or PRP is not the application. ARTIS might be. The guy who has more advanced hair loss or looking for maybe more volume, multi-unit hair grafting really can't be beat at this time. And something we're very excited about, very proud of. And this example here, for example, this patient, you can see his before picture, and you can see now as his hair is growing in over the course of the year, he chose to have the multi-unit hair grafting procedure done. He lives in Indianapolis. When he called up, he said, I'd heard about the multi-unit hair grafting. I want to come and have that done. I'm going to bring a friend. I've got one day to do this. I'm a busy businessman. I don't want to have to come back for multiple surgeries. What would you suggest? And I said, well, multi-unit hair grafting fits your need. Come in. And as you can see, there he is before, there he is 4 months later, and here he is 1 year later. Now let me pull up his his friend's pictures. This is his friend that came in, who's from New Zealand, by the way. Don't hate him. This is Darren. And you can see Darren before. Here's Darren at 4 months, and here's Darren at 1 year. So Darren chose multi-unit hair grafting. So again, one of the things that you brought up is we can offer an array of options depending on the patient's concerns and needs.
Now, I've gone from one extreme to the other, where I thought there was perhaps just one procedure, but now there's a variety of procedures, and I don't quite know where I would fit, which I think would be a vast majority of people at home. Now, the very next thing that I would do is come in for a consultation. And you guys offer another service, which, I mean, I know that you're in Nashville, but if someone perhaps is in Chattanooga who might want to come and thinks, you know, it's a little far for me to get there, you can do some online stuff.
Yeah, we were the first center in North America to offer something called virtual consultations. You hear that word now, but 10 years ago we started doing this, and it's a great tool because even before Skype was around, patients would send us pictures of themselves, have us do an analysis of their hair loss, and we would do something called a webinar using a service called WebEx, where we can go in and show them some PowerPoint slides of patients with similar hair loss to their own, how that patient was before, how the patient is after the procedure they had done, whether it's surgery or non-surgery. And so we could use this tool, and it's great for patients that, as you said, live too far away, or maybe patients that live in town that are just too busy, much like you. You know, you may say, hey, Michael, let me check out the virtual consultation option first. Let me kind of kick the tires to see what this is really all about. Let me narrow my options before I decide to drive to Brentwood to come in our office. Yeah, Brentwood's not far, but if you live in California, it's a haul, or if you're busy like you are, it's not convenient. So virtual consultations are a great way to find out what's best for you.
Now, I know your consultations, be it virtual or in the office itself, you know, are very in-depth. It doesn't take a long period of time, but talk about that process. So if I am someone who wants to come out to the Brentwood office and see you in person, what sort of time frame and what do we go through? Okay,
so the time frame can be 30 minutes to a little over an hour. One of the first things we do is something called video microscopy. We use a special video microscope to look at the person's hair on the sides and the back to determine how healthy that hair is. That's called donor hair if they have a transplant. But we use this tool mostly to determine the health of the hair on the top of the head. And then that helps us guide them as to the right choice for what they're looking to achieve. This scope has the ability to magnify the scalp up to 50 times, and that gives me and our medical team the ability to better tailor the treatment. Because a lot of times a patient may look in the mirror and think they're bald, when they may not in fact be bald. When this scope looks at their hair and they have thousands of little small vellus hairs that often can be revived with a non-surgical option. Laser therapy, PRP, those types of things. So it's a good tool. We're one of the few centers in the U.S. that uses this tool. We think it's valuable, so we use it in pretty much most consultations.
I mean, and I think to that point, there's probably a lot of people at home who are thinking about this procedure. And I think just talking about it and getting into the office and seeing what your options are the best place to start, rather than thinking you've got this mountain to climb when things like PRP, which is a fantastic technology, may just be the answer. So relatively invasive. But if you guys want more information, of course, jump on to wegrowhair.com. And you can also contact Michael Ramsey through that website, and he is very accommodating. So we will see you next time on Nashville Health and Wellness Program.